Good afternoon. Thank you for coming at short notice. I'd like to apologise to the hard of hearing community because our interpreters, unfortunately, were already booked, and it was such short notice they couldn't be freed up. They are a valued resource, and poor ladies never have a free moment, I fear. The reason for today's in-person media briefing, I think, is best summed up as dealing with social media gossip and rumour. So maintaining our previous format, I will hand the podium over to Dr. Fitzgerald. Thank you.
Thank you, Minister. Good afternoon, everyone, and thank you for joining us today. So we provide an update on COVID-19. So we have one new case since yesterday in the Eastern Health Region as male over the age of 70. So we currently have 4 positive COVID-19 cases in the community of Grand Bank, all of which appear connected. And at this time, we have no evidence of community spread. So that means we worry about community spread when we have cases where we cannot identify the source of the infection. So we do not have community spread at this point. In the last 24 hours, the situation in Grand Bank has heightened everyone's awareness and anxiety with regard to COVID-19. And I know that this is alarming for the community when situations like these arise, and I caution people not to panic or contribute to the rumour mill. Public Health and Eastern Health are continuing the investigation, including contact tracing, case finding, and education for those identified at increased risk and for the community as a whole. The public health officials in our regional health authorities have significant expertise in contact tracing and investigation. Their role is to identify and contain the spread of the virus in order to protect the health of the population. I have said before that we must expect cases. The goal is not to have 0 cases. The goal is to contain the cases that come into the province. This needs to be a stark reminder to everyone in the province that COVID can raise its head at any time and in any place in our province. While concern may be higher, this is not the time to panic. There are so many things that we can all do to reduce the risk of spreading COVID-19. 1, keep your contacts as low as possible. Avoid gatherings with people outside of your close, consistent contacts. Avoid crowded spaces. Work from home if possible. 2, practice physical distancing. 3, wear a mask in indoor public places. 4, wash your hands frequently and well. 5, stay home if you're unwell. And 6, if you are unwell, connect with 811 or complete the online assessment to determine if you require testing. If testing is recommended, please get tested. Many people with mild symptoms are not reaching out for testing, thinking they only have a cold. This is a mistake. We cannot deal with a case of COVID-19 if we do not know about it. As I said yesterday, we need to have all of these layers of protection against COVID-19, and no single layer on its own will keep us safe. Travel restrictions will not keep all cases out. Quarantine will not stop all cases from getting into our communities. And contact tracing will not be as effective if we each have 15 to 20 contacts to follow up. We all have to do our part. We have seen recent outbreaks and community spread within the Atlantic bubble and in Nunavut, areas that have been doing remarkably well, like ourselves. There, but for the grace of the COVID gods, go us. We are not immune nor special. COVID doesn't care where you live. We must take this seriously. We have been incredibly fortunate to keep COVID at bay for as long as we have, and your efforts have been a huge part of that success. I suspect that people are becoming more complacent of late, and I get it. We're all tired. I'm here today to tell you that our fight is not over and that we have to stay the course. So please, Newfoundland and Labrador, hold fast. Thank you.
Thank you very much, Dr. Fitzgerald. Well, this is our 100th live media briefing, so we've hit the century. The reason for it today, though, I think speaks to some of the issues Dr. Fitzgerald has highlighted. Contact tracing takes a little bit of time, even with a skilled workforce. There are people that have to be contacted, details of their movements tracked, and the speed of rumour is keyboard and instant. And I think the challenges that we've seen over the last 24 hours really highlight that and highlight the confusion and agitation and fear that ill-informed comments on social media can make. The information that we release through our briefings and through our news releases is that which our public health physicians feel is necessary to protect the public, keep them safe, and allow them to take informed measures to help themselves. Set against that are individual rights to privacy, and as Minister of Health and Community Services, I am the lead custodian of the Personal Health Information Act. We release the information as we get it and in a timely way as is needed to protect public health. Yesterday, I think, after our media briefing, a decision was made by the Medical Officer of Health for Eastern Health that because of the speed of rumour and gossip in the communities involved in yesterday's new cases, he felt it important to send a letter to the residents of Blue Crest cottages and also to inform the elected leaders of the communities down there in an attempt to allay the fears that social media was stoking. We try our best to have as accurate information as possible, to release it in as timely a way as possible. But at the end of the day, we cannot beat the keyboard warriors who will sit there and do their thing. We have had a great response from our mainstream media. They understand the nuances and the time it takes for contact tracing, and by and large have been patient and allowed us to present information in a way that is useful to the people that we and they serve. I think, unfortunately, social media does not follow any of those kind of rules, not follow any of those kind of standards. I can do no better than to reiterate Dr. Fitzgerald's comments that if you have symptoms, you should self-assess online or call 811. I think what we're seeing now in terms of cases shows the importance of being able to track your contacts. So the part you can play is either to download the COVID Alert app or alternatively to keep a rolling 2-week diary of all your contacts, anyone you spend more than 15 to 20 minutes with in close proximity, and keep that up to date. Those are your options. I know which one I'm using. I'm using the phone. It's easier and it's secure. So with that, Kathy, I think I'll conclude my remarks and hand it over to you for the question and answers.
Thank you, Minister. For the benefit of our speakers, we have 4 reporters registered for today's call. Each reporter will have the opportunity to ask 1 question and 1 follow-up. Following this, if time permits, I will ask each reporter if they have any further questions. We suggest that you ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions are from Peter Jackson of the Telegram. Please go ahead.
Hello. I guess in this case it's okay to ask rumor-based questions. And I'm wondering, can you confirm that the index case in this case was a rotational worker?
So the index case, which is the first case that we become aware of, is not the rotation, was not a rotational worker.
Okay, thank you. And my next question is, are there any public spaces on the Burin Peninsula, either in Grand Bank or Marystown, that may have been a source of possible exposures?
At this time, we do not have any reports of public places that would be considered exposures.
Thank
Our next questions are from Jody Cook of NTV News.
Either through calling or the self-assessment online and determine if they need testing. And if they do need testing, they need to make sure they follow through on that.
Perfect. And Dr. Haggie, you alluded to just how important it is for people to be aware of who they do come in contact with, and how can they do it, and how important is it to have the app and be aware of your contacts.
That is the basis for contact tracing. We have a very good track record in this province of contact tracing. Indeed, I would argue one of the best in the country. We have anywhere from 80 to 90% of contacts identified and located within 48 hours of the index case. The best average, as it were, for the rest of the country used to be 60 to 70%, but indeed I draw your attention to some jurisdictions such as Ontario, which have essentially given up doing that because of capacity issues, because of the numbers they're swamped with. The easiest way, if your memory is like mine, is to use technology. Download the COVID Alert app, put it on your phone, activate it, and it's totally anonymous. If you then test positive, you can seek a code, and this will unlock your phone, and your phone will then notify any other phone that it was in contact with over the period of the days in advance of you activating it. There's no central collection. If your phone should go off and give you an alert, you should call 811 and make arrangements as advised through them. The other alternative is to get a piece of paper and a book and write down every name of everybody you spend 15 minutes with closer than 6 feet, and keep that on a 2-week rotating basis.
Thank you.
Our next questions are from Richard Duggan of VOCM News. Please go ahead.
Thank you. Dr. Fitzgerald, you mentioned just a few minutes ago that this person, the initial case, is not a rotational worker. Can you tell us where this case arrived from?
So the index case is the first case that we become aware of. That person was in contact with a traveler who had tested positive. So that's what happened there.
Okay, and in terms of this person's activities, do you believe that there was a public health violation of public health measures here?
I'm sorry, you sort of cut out there partway through, sorry.
Yeah, do you think that there was any sort of violation of public health measures in this situation?
So the details, I can't really comment on the details of any one individual case, but there are, with everybody, there are measures in place to ensure that people are being as safe as possible, and we certainly would hope that and expect that people are following those guidelines and those rules, because in some cases there are actually special measures orders.
Thank you.
Our next questions are from Mark Quinn of CBC News. Please go ahead.
Yes, thank you. Dr. Fitzgerald, you mentioned a fourth case just a few moments ago. Can you give us the usual information you give us about a new case, their age, their location, and how they contracted the virus?
Yes, so I did say a little earlier, they were in Eastern Health, over the age of 70 and male. And they are a contact of a previous case.
And a contact of which previous case?
So I can't really say that information, but they are a contact of a previous case.
Okay. And sorry, as a follow-up, it's curious that the woman who is the index case tested positive before the man who she appears to have contracted the virus from. Can you sort of shed some light on how that could have happened?
So in any situation, it depends on who comes forward for testing first, and that's the the simple truth of it, I guess. It's so some people may present with symptoms before another person does. Some people may have reasons why they get tested before another person does. The part of contact tracing is looking at what all the scenarios could potentially be and what would be the most likely scenario, and piecing all that together. Sometimes it's a bit of a puzzle, but we piece all that together to find out what the chain of transmission would have been. So that's part of the expertise of our contact tracers.
Thank you.
We have about 10 minutes left before we have to conclude this call today. So our next questions are from Peter Jackson of the Telegram. Peter, if you could ask one question, please.
Yes, sorry. I'm a little confused about the index case again. You say that person was in touch with a traveler. Is the traveler not considered the first case because they did not test positive in this province?
No. So both cases tested positive in this province.
Okay.
Our next question is from Ben Cleary of NTV News. Please go ahead.
Moving forward, should residents on the Burin Peninsula and Grand Bank, should they be extra careful over the next few weeks? Should they avoid gatherings and doing things that they may normally be doing?
So, as I've been saying for quite some time now, we should all be avoiding gatherings. This is not normal times, okay? This is not 2019, this is 2020, and 2020 is quite different from last year. So we need to make sure that we're reducing our contacts as much as possible everywhere in this province, not just on the Burin Peninsula. That's where the story is today. Tomorrow it could be on the Northern Peninsula, and the next day it could be on the Port-au-Port Peninsula. So we need, and it can be anywhere. It can be in central Newfoundland. I'm not trying to pick on peninsulas, but this is something that we all need to take very seriously. You only need to look at what's happening elsewhere in the country to realize how quickly this can get out of hand. And I cannot stress it enough how important it is to follow the guidelines that we have put out. We should be looking at this very similarly to how we looked at things in April, and really try to reduce our contacts as much as possible. As I said yesterday, there's a tsunami just out there off our shores, and I'm telling you, it's just waiting to crash down on us. And we cannot keep it at bay with travel restrictions. We cannot keep it at bay with quarantine. It's going to take all of us doing our part to keep things safe here in this province. And we are going to see cases, and we're probably going to see clusters. But as I said, if you have 15, 20 contacts, and we have been seeing that contacts have been going up lately, that we've had more contacts with some of these cases that we're tracing. If we continue to see that, then we're going to have a bigger risk of spread. So it's really, really important for people to keep their contacts down.
Our next question is from Richard Duggan of the OCM News. Please go ahead.
Thank you. So correct me if I'm wrong, but I believe that the plan that was announced a few months ago in terms of how we respond to any sort of rise in cases in any one area would be that we there would be a tightening of restrictions, if necessary, in particular regions of the province. So given this rise in cases in Grand Bank, are we considering tightening restrictions in that area?
So at this point, we're still very early in that investigation. But at this point, what we're finding is that all of these cases are connected. So we're not seeing any spread, beyond that cluster. If we had what we call non-epidemiologically linked cases, so if we had cases where we could not find the source of the infection and we couldn't relate it back to travel or to a cluster, that would be quite concerning for us, and those are the cases that we worry about the most, because they could be an indicator of wider community transmission that we just don't know about yet, because people haven't gotten sick enough to end up in hospital, or they haven't come forward to get tested. So those are the things we worry about. But if we all do our part and we keep our contacts down, if we make sure that we stay at home if we're sick, if we get tested with mild symptoms, even mild symptoms, then we can reduce the risk of community transmission. I'm not saying that we will exclude it completely. We have seen how that can happen in other areas that honestly have done everything right and have put in as much effort as we have put in this province to keep their cases low. We can just see how it can explode very quickly. So, we all have to be aware that that's a possibility, and we all have to do our part to reduce the risk as much as possible.
The next question is from Mark Quinn of CBC News. Please go ahead.
Thank you. With what you described as the tsunami waiting outside of our borders in Newfoundland and Labrador, and what happened in this case where there's a rotational worker who seems to have transmitted it to someone in his household who seems to have transmitted it to someone outside of that household. Is it time to tighten restrictions on rotational workers and their households?
So those, obviously those are all conversations that we're having, and we put things in place with regard to rotational workers, as we have done with everything. We always say we will review if the evidence changes. So those are conversations that we're having. I don't have any updates at this point, though.
Thank you.
Peter Jackson, do you have a final question?
Yes, I do. Sorry. I still want to confirm, are any of these 4 cases a rotational worker?
Yes, there is one.
Okay, thank you.
Ben Cleary, do you have a final question?
That's it for me, thanks.
Richard Duggan.
I just have one. There are workers, care workers, going in and out of Blue Ridge cottages. So I was just wondering, what protections, or are there any protections being put in place to help protect those workers now that we know that they're going into an area where there have been confirmed cases?
From our point of view, the operators of Blue Crest, it's run under the auspices of Eastern Health, have access to any PPE they may need. And that's an operational issue for Eastern Health to address. We have no PPE shortages in our supply chain at the moment, and our inventory of what we would like to have, for want of a better word, in terms of pandemic supplies, is pretty well 80% of where we would like it to be should we have another surge.
Thank you.
And Mark Quinn, do you have a final question?
Yes. Can you say if the 4 cases, what their state of health is? Are they asymptomatic? Are they symptomatic? Is any of them hospitalized?
So I don't know that I have that information right to hand, Mark. But certainly, if you want to follow up, we can see what we can get for you.
I'll send an email. Thank you.
Thank you.
Thank you very much for tuning in. Minister, do you have any final comments before we conclude today's news briefing?
Yes, thanks very much, Kathy. The only thing that stood out in my mind was the issue of the word index. It's a word used in a very specific fashion for epidemiologists and public health physicians. An index case is simply the first one tested and diagnosed with a condition. It doesn't speak to the order in which people were either symptomatic or infected. It simply speaks to the order in which they were tested. And I think that may be a source of confusion for some people in our general viewership. Other than that, I'd like to thank everyone for making time at short notice, and I hope that this provides some clarity around the situation. I would once again encourage people who have any concerns about their health to reach out to a healthcare provider, and I would regard any information on social media that isn't from a truly verified and known trusted source to be treated with a degree of skepticism. I think today's conference call, whilst necessary, was generated as much by social media as it was by any case of COVID. So with that, I'd like to thank everybody and wish you well.
Thank you very much for tuning in, and have a safe day, everyone.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.